Well, good afternoon. Earlier this week, I ordered a full report from the Canadian Forces to be made public. I wanted everyone to see what I saw, because getting more eyes on the situation was critical. I wanted the public to know exactly what we're dealing with, because it's only through openness and transparency that we can ensure those who need it will be protected, that we can ensure there'll be accountability, that we can ensure there'll be justice. And I stood at this podium day after day. I promised you there would be action. I promised you I would break down the silos, I would push the system, and we're moving at lightning speed. We've taken decisive action. We appointed temporary management of 7 homes in the system. We're deploying inspection teams to our homes. 6 teams of inspectors will be actively monitoring the hardest hit homes for the next 2 weeks. In the next 3 weeks, there'll be a full inspections of every home we're concerned about. And we'll be doing spot checks in homes throughout the system. We launched a full investigation following the military report. The Chief Coroner and the Auditor General have also launched investigations. And we moved up our independent commission to July. No stone will be left unturned. We're working around the clock to keep your loved ones safe. We're pulling in reinforcements, boots on the ground from every corner. Hospitals, public health, home and community care, volunteers and students, our men and women in uniform. Everyone is pulling in the same direction. And in April, our government set up an incident management system long-term care table to rapidly respond to problems in our long-term care homes. This is a multidisciplinary team of experts. This table is made up of the best and the brightest. We sent in our COVID-19 SWAT teams to help with infection prevention and control, support appropriate staffing levels, and complete testing of all residents. We filled priority requests for PPE within 24 hours. Millions of protective masks and gloves that our frontline staff needed. We worked with our hospitals to partner them with long-term care homes in urgent need of support. We were, and we still are, all hands on deck. And we will keep going until the job is done. So today, I'm extending the mandate of that table, and we are seeing results. Positive tests for COVID-19 among residents have gone down to single digits. We have completed testing in all of our homes, and the second round is well underway. And in the event of a surge of new COVID-19 cases in the community, we will be prepared. My friends, we're sparing no expense. We're stopping at nothing because the stakes are too high. We will do whatever it takes in our power to protect our most vulnerable seniors and ensure they get the care they deserve. That is my commitment to our long-term care residents, to staff who care for them, their families, and to the people of Ontario. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Today, our government is renewing the mandate of the Incident Management System Long-Term Care Table, also known as the IMS Table. The IMS Table meets daily to organize efforts across multiple providers and ministries and make rapid decisions to support long-term care homes in need. Homes identified for support are those struggling to maintain clinical stability, complete infection prevention and control assessments, ensure appropriate staffing levels, have access to personal protective equipment or PPE, and complete the testing of all long-term care home residents and staff. Through the work of this table, we have seen marked improvements to our long-term care homes affected by COVID-19 outbreaks. Some key improvements are, since May 1st, increased the numbers of low-risk green homes from 356 to 547 homes, representing 87.4% of all long-term care homes in the green zone. Since May 1, reduced the number of high-risk red homes from 35 to 19. That's a 54.3% improvement. And as of May 27th, the IMS has deployed 37 hospitals into 59 yellow homes and 19 red homes. Completed testing of long-term care resident and staff with a second round of testing already underway. The number of COVID-19 positive tests in long-term care homes decreased from 12.5% to 7.5%. And as of May 28th, 129 out of 626 long-term care homes are in active outbreak from a high of 190 on May 18th. 164 outbreaks have been resolved. And what we saw in the reports from the Canadian Armed Forces was gut-wrenching and appalling. And my heart goes out to the families and loved ones of those affected by these allegations. These 5 homes were the absolute hardest hit homes in our province from COVID-19 outbreaks and staffing issues. And that is why our government requested the assistance of our Canadian Armed Forces to help stabilize these homes. Additionally, our government has taken immediate and direct action to investigate and correct these situations identified in the Canadian Armed Forces report. I can confirm that the teams of inspectors announced yesterday are currently in all 5 of the CAF homes today. And these teams of 2 inspectors for each home will develop customized inspection plans based on the details outlined in the CAF report. These comprehensive inspections will include record and chart reviews, in-depth interviews with staff and residents, and observations in order to determine the extent of the issues, among other items the inspectors deem necessary. The 5 long-term care homes that received CAF support have undergone 45 inspections from June 2018 to May 2020. These 5 homes have been receiving support from hospitals, Ontario Health, the Ministry of Health, the Ministry of Long-Term Care, as well as Public Health Ontario. And also, inspections have been scheduled to occur at all the 19 red homes within the next 21 days. With respect to yesterday's announcement about alternative management being appointed at several homes, I will provide you with the list of managers being appointed to those homes. Trillium Health Partners will be managing Camilla Care. Unity Health Toronto will be managing Eatonville. North York General will be managing Hawthorne Place. Scarborough General will be managing Altamount. And I want to thank these hospitals for assisting our long-term care homes during this unprecedented time. As the Premier said yesterday, we will use every tool available to stabilize our long-term care homes. The safety and well-being of our residents, their caregivers, and their families are our #1 priority. We will get through this. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Lucas Meyer from Newstalk 1010. Please go ahead.
Thank you very much. Premier, on the inspections of the 4 specific homes laid out in the military report, are you setting a specific deadline on a decision for those 4 homes? I mean, you said yesterday that you wouldn't hesitate to revoke licenses. So for those 4 ones, after these 2 to 3 week inspections, is the government prioritizing that decision, and by then you will have made a decision on the future of those homes?
Yeah, first of all, there's actually there's 5 homes. We added one got out of the red and 1 went in, so we have 5 homes that we're inspecting. But we'll review it and we'll make that decision then. And hopefully we can get these homes to follow the proper protocol.
And on another subject, Premier, this came up a little bit in March, but the government announced today the preliminary Ontario-York Region transit deal, while also calling for the feds to pay up. But I'm wondering, given the pandemic, are you considering postponing any of the major transit projects, and have you gotten any indication that federal transit funding may be on hold, in which case projects could be affected as well?
Well, absolutely not. And this conversation comes up every single Thursday. It's going to come up again with the Prime Minister when we have a conference call with the premiers. Infrastructure is critical, and there's no better way to get people back to work anytime. You go back to the Depression, it's infrastructure. We need to continue building these lines for the next 50 years. We just can't stop right now. It's too far down the tracks, excuse the pun, but we're building these 4 lines because we need people to get moving. We need traffic congestion to slow down, people to take rapid transit opposed to hopping in their car. And environmentally, I think it's great. So we need the funding from the feds to step up and do their 40% that they usually do. And they've been great so far, but every single week this conversation comes up about infrastructure. We're putting our fair share in, and we'd really hope that the federal government would put their 40% in.
Next question.
Next question comes from Travis Danrush from Global News. Please go ahead.
Hi there, Premier. Good to talk to you today. I had a question from yesterday that I'm going to ask you today about the report and the inspections. Inspectors from the Ministry of Long-Term Care had visited all 5 facilities in recent months, right before the pandemic, and they reported violations in all 5 of them. Some of the incidents are very similar to what appeared in the military report. In some cases, there are multiple incidents. How can you say that your government didn't know about this until the military report told you about it? And if the government knew, which clearly is the case, why was nothing done for months?
Well, I'll pass this over to the Minister of Long-Term Care.
So we've had many inspections of the homes, as you've mentioned, since June 18th. These homes were inspected about 45 times. So when we look at the homes, we typically have to provide a supportive measure. So there's compliance orders, there's a number of more serious issues if there is outright neglect. And we work with the homes to support the staff and make sure that they can provide the standard of care to the residents. But we've been in a staffing crisis with our personal support workers for years. This has been an ongoing issue, and it was something that our long-term care ministry was addressing through an expert panel to understand how we could help our homes have the right supports, get the proper amount of staff. But this is an ongoing issue, and it will have to be addressed in terms of how we get the staffing that is needed into our homes.
Okay, Premier, I have a question for my colleague David Aiken in Ottawa. He wants to know about what measures you are going to be asking the federal government to help when it comes to long-term care facilities, and what are you going to tell the Prime Minister when you talk to him?
We need funding. We can't do it alone. No province can do it alone. We need their support if we want to change the system, a broken system that's been around for decades. We need money. That's what it comes down to. And if we get the funds, then we can make some massive changes. But we need the money off them.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Brian.
Premier, you've said that you'll stand by your Minister of Long-Term Care. You haven't ruled out pulling licenses or taking over more homes. But I want to know about the other part you haven't discussed, and that's the bureaucracy. Many of the people in charge of the long-term care file right now have been there for years. Your current Deputy Minister of Health, Helen Angus, was Associate Deputy Minister from 2012 to 2014, almost 3 years in charge of long-term care when there were many problems. Stacey Kolomenko, who is in charge of inspections right now, has been in an inspections role for years and years. Brian Pollard, Assistant Deputy Minister, same thing. These people have overseen the rot that's been going on. Do you need to have a shakeup, and does there need to be accountability for bureaucrats that have not fixed the problem or perhaps have hidden the problem? They're part of the issue. Will you deal with that side of the equation?
Well, again, throughout our review, that's going to come up, and people will be held accountable. Brian, right now, the system has been broken for decades, as you acknowledged, and in other areas in the government. When a pandemic hits, no matter here in the government or in the private sector as well, I've talked to so many private sector folks saying, "Hey, we can do things differently. We can do things more efficiently. We can digitize the province, which we're going to be doing. And there's a lot of changes that need to be done. And we're going to make sure that those changes happen. We're going to have a better system at the end of the day. We have three areas or three stages, if you want to call it, making sure that we take care of the immediate need of these homes right now. And then the second stage is what are we going to do for the next 3 months? And the last is what are we going to do for the next number of years as these lineups are going to start when the baby boomers come of age to go in these long-term care homes. So we have three areas that we're going to focus on, and part of the commission is going to look at the long-term care of these homes. It's absolutely critical. But we know where the problems are, Brian, and we're going to fix them.
The inspection issue, I want to know if OPSU, Smokey Thomas, the union representing inspectors, stopped or impeded in any way in-person inspections from starting up again. They stopped for a time when Dr. Williams issued his order, but I have an April 22nd letter where Smokey Thomas wrote to you and Minister Fullerton saying that due to inherent risks to multiple parties from such inspections, this plan is not only ill-advised but not necessary. So did the union get in the way? Did inspectors refuse to go into homes after the government decided that in-person inspections needed to continue?
Well, Brian, I'm just going to lay the chips on the table here. You know, I've been taking bullets every day for the union up here. And, you know, when you said they were doing, or not you, but when I've been asked about, they were doing telephone calls for inspections. Well, the truth of the matter is they were refusing to go into these homes. And I want to qualify something. I think the world of Smokey Thomas. I have a great deal of respect for Smokey Thomas. But sometimes it's difficult, sometimes it's difficult to deal with the provincial staff, as you were just mentioning, which I don't have a big issue with, but sometimes he might have challenges. I haven't asked him that personally, but they refuse to go in. And what you do when you have the union saying they aren't going in the door, and believe me, Smokey's an incredible leader, and thanks to him, they're going back in. So by no means is this Smokey Thomas's problem, but the unions. And you know something? Let me be fair to them too. That's why I've been taking the bullets for them every time people ask me that question. You know, I understand they were scared. This is in April. This was the peak of COVID, and all heck was breaking loose, and they were nervous about their families. They were worried about their health. I get it. You know, they aren't medical professionals, so I understand it, but I'm not going to continue taking bullets for something that there was no control that we had when the unions refused to go in. But I understand their situation. The good news is, out of all this, the good news is, thanks to Smokey's leadership, they're going back in, and they have been going back in, and they're going to continue to go back in. And as for the inspectors, you know, I understand. I understand why you'd be nervous. I'd be nervous as well. And that all goes back how grateful we are for the frontline healthcare workers that went in when no one else would go in. Thank God. And it goes back to, why do you know, well, when you don't have people going in, they're doing inspections over the phone in April. That's the reason we had to call the military in too. We knew there's issues. Let's call the military in after bringing everyone else in on top of it. As we brought the hospitals in, we brought the community health in. We're bringing everyone in, and finally, we brought the military in, and thank God we brought the military in, and I want to thank them for staying till June the 12th. We're very, very grateful for our Canadian Armed Forces. So that's kind of the story behind, you know, when I get these questions about they were telephone calling.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Premier.
Hi, Cynthia.
Hi. I'd like to hear more about this, because if inspectors were refusing to go in, why didn't your government act far sooner and get people who would go in to make sure that everything was okay?
Oh, well, I'll pass this over to the minister, but we were getting everyone to get in there that were willing to go in. We had homes, and you remember this, and I'm sure, to be very frank, the media knew that the unions weren't going in. I don't know why they weren't reporting it, but here nor there. People were leaving their post, you know, and I understand. I get it. They were nervous. Everyone was nervous. This was something new. People were dying. And the healthcare workers, I want to thank them for staying in there, and the other homes for staying in there, but they were leaving. We were getting everyone possible in there. We were getting the hospitals in there. We were getting public health in there. We called out for volunteers. You know, retired nurses were coming in there. We were throwing everything in the kitchen sink at this. But I'll pass this over to the Minister of Long-Term Care.
So if you look around the world, you see countries around the world impacted in the same way as Ontario's long-term care homes have been. And concerns even worse in some other countries where homes were entirely abandoned. That didn't happen here, fortunately, and we were anticipating from the very beginning back in February the need to have flexible aspects for staffing and looking at ways we could do that because we were already in a staffing crisis before COVID hits. Many reasons for that, but that is the reality. And then we started to say, okay, well, how can we create flexible staffing, allow our homes to adapt in a very rapidly changing environment, and especially when a COVID outbreak starts happening. The speed with which COVID-19 moves is shocking. I've spoken to physicians and nurses who've been in these settings. They've never seen anything like it. So we not only were trying to adapt to the circumstances, but we're also trying to anticipate what could happen next. And based on the best science and evidence that was being gathered by our medical experts. But even that is changing so fast. Even keeping up with that is challenging. So looking at the homes, understanding how we could get more people in as staff started to have to self-isolate or were afraid, and absolutely understandable why they would be afraid. So again, we had public health go into our homes. All homes were risk assessed. We had volunteer portals, both provincially and federally. The nursing RNAO was helping to develop a list of nurses that might be available. And if you look at our aging population, you understand, you know, the shift in ratio of working age to non-working age. That's going to be an issue as we go forward. That old age dependency ratio or the dependency ratio is going to be a factor. And coming out of COVID, our staffing is going to be a factor. We've used every measure and every tool to get people into our long-term care homes. And it's so critical that we change the nature of how we integrate long-term care into our communities with our acute care systems. That's why we have Ontario Health teams. We have to have a new process going forward. Staffing is a critical piece. Thank you.
Okay, Premier, my next question is for you. It's on a bit of a different topic, although I have a lot more questions I'd like to ask you about this. Over the weekend, how the data is classified or categorized changed. So community spread has dropped almost 50% to 18% community spread versus before the weekend it was roughly 34%. And it's because they're looking at community spread differently. And if you caught it in at work, for example, it's not considered community spread anymore. It's considered close contact. I guess my question is, with this new categorization and the significant drop of community spread, will you consider, does it pave the way to opening up phase 2 sooner?
Yeah, well, before I pass it over to the Minister of Health, first of all, I want to thank the health team. I want to thank the folks at Public Health. The numbers have jumped up. There's more testing, over 17,000 tests, and we're seeing overall, the last couple of days at least, the numbers going down, and hopefully we're going to continue on that trend of more testing. So I appreciate the work that they do. You see, sometimes it's up, sometimes it's down, but they're all working really hard. And to talk about the details, I'm going to let the Minister of Health come up here and she'll explain it. Thank you.
Well, thank you, Cynthia, for the question. This is really important, and it's something that we're looking at on a daily basis to understand the number of new cases. What does that mean in terms of community spread versus results from long-term care and so on? As you may know, the number of cases increased today up to 383. This is in part a reflection of the opening of the economy last week, but there was also some long-term care data that was still involved in that. Dr. Williams and I are looking at this on a daily basis to understand what all that means in terms of opening up stage 2, but I think we need to see the data for a few more days to see if we increase the number of cases. If we start going back into the 400s and 500s, then we're going to know that we need to be a little slower in opening up stage 2. But right now, Dr. Williams, he'll be discussing that this afternoon, but we both feel relatively comfortable with this number, knowing that it was likely the number of cases were going to increase somewhat with the opening up of the economy. But I think we still need to have another week at least go by to see the numbers before we can contemplate going into stage 2.
Next question.
Next question comes from David George Kosh from BNN Bloomberg. Please go ahead.
Good afternoon.
Hi, George.
Premier, some of Canada's largest institutional investors are among some of the top shareholders in publicly traded companies like Sierra Senior Living, which owns one of the properties documented in that Canadian Forces report. What is your message to those investors? Should these investors expect these big publicly traded companies to sacrifice profit for quality of care?
What they should be doing is doing their job, protecting the seniors. You want to invest in a company, then make sure the company's run well. You know, any of us that are listening right now, you buy a stock, you have to do your due diligence to make sure that the product is good. And on these homes, specifically the ones that Canadian Armed Forces in, they failed. And I would expect, as a shareholder, to start holding the CEO and the chair accountable. That's what happens in the real world. You put a lousy product out there, and you know something happens to your product, well, they have to be held accountable. Because guess what? We're going to hold them accountable.
And a more broader question, but has Ontario explored or engaged in early discussions with any companies that are in terms of taking an ownership stake in a distressed business to provide them with any capital support during the current pandemic?
Not that I'm aware of.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi,
I feel like there's a lot to follow up on here based on some of the comments you've made today about the inspectors and now about the CEOs of some of these long-term care for-profit companies. I'm wondering first why the province didn't take action. It sounds as if it felt paralyzed by the refusal of these inspectors to go into the homes. You're the Premier of this province.
No.
Why were you not able to intervene, and why did it take, it sounds like, weeks for some action to come to some sort of a head here?
Well, let's be very clear. We took lots of action, a tremendous amount of action. As we said, we ended up connecting them with hospitals. Hospitals were going in to support them. We had public health going in. We had the volunteers going in. So we took a lot of action. But in saying that, when you're dealing with a union and the inspectors are saying they aren't going in there, you know, as much as we tried, we didn't just sit on our hands. We were working with them, trying to get them in there, giving them PPEs, guaranteed they'd have protective equipment. And when they don't want to go in, they aren't going in. But I want to turn this on the other side. I want to thank Smokey Thomas for getting them back in there. You know, we could talk about the weeks or within April when they didn't want to go in, but they're back in there, and we put everything we had available in the resources to go in these homes, and they did go in. The hospitals went in to support them, and then finally, we said enough's enough. We have to get the Canadian Armed Forces in, so we threw everything we could at them. It wasn't like we had extra resources and we weren't doing, or we weren't trying to get the unions in. We were doing everything we can. And I know, I'm sure Smokey Thomas was doing the same. I don't know the inner workings of the union. All I know is they refused to go in. And, you know, I stood up here for the last week taking bullets for them. Well, enough's enough. You know, they have to be accountable too.
And Premier, on your comments there about the people in charge of these for-profit companies, you say you're going to hold them accountable. What does that mean? What can the province do when it comes to these companies and the standard of care at these homes? I mean, do you need to, as a province, regulate a specific hourly standard of care for residents to ensure that seniors are getting the attention they need?
Well, you know something, I've always been about cutting red tape and regulations, but when it comes to long-term care, we have to have more regulations. We have to make sure that they have the PPE. We have to make sure these companies, these $100 million a year companies, aren't sitting there with a lock and key keeping the PPEs in the safe while the frontline healthcare workers have to reuse the PPEs. You know, I not only do I have to protect the patients, I have to protect the workers there too. And nothing drives me more crazy than these big corporations say, no, we're watching dollars and cents. There's a lot we can do. Number one, we can pull their license. Then they won't have to have a home to worry about. Trust me, we're as this review goes on, we'll be taking action. We'll be holding people accountable because it's not about money. It's about taking care of people, taking care of the workers, making sure the families are okay. That's what's important to me. Not about making money. And if they want to be greedy and make money, then get out of the business. Go find something else to do. Don't put people's lives in jeopardy.
Last question.
Last question comes from Robert Benzie from the Toronto Star. Please go ahead.
I'm not sure if this is a question for the Premier or for Minister Fullerton, but Minister Fullerton was mentioning 19 long-term care homes that are considered code red, and those would seem to me to be the next ones that could be taken over. Are you going to release the list of those names so that the public can know and the families of people in those homes can know?
I'll pass it over to Minister Fullerton.
So it's a good question. And if you really look at the dynamic nature of what's happening in our homes are shifting. If some of them are in red, they'll switch to yellow. Some of them that are yellow will switch to red. Typically, they're moving out of red. But knowing that there's a dynamic nature to this, that's why we have to keep monitoring every day, and that's why the IMS table meets every day to review this. It's an ongoing process. It's a very dynamic process. And the trend right now appears that our homes are all improving, and there is simply a small number that have a dynamic that's really problematic, and that's why we've allowed the formality of the hospitals to go in there and make sure that that's formal.
And on a slightly different subject to the Premier, we've seen in Manitoba, we've seen in New York State, we've seen in Quebec, we've seen in Alberta that those jurisdictions have opened their economies up by region. Other than the Greater Toronto Area and sort of Niagara, Ottawa, and Windsor, Ontario could open up. There are places in Eastern Ontario and Northern Ontario that could open up because they just don't have the cases. Why are you resisting this, regional opening and sticking to the one-size-fits-all? I mean, people in Kenora can go across to Manitoba, where the economy is open. It doesn't really seem to make much sense to treat them the same as you're treating people maybe in the Greater Toronto Area. Yeah,
Robert, I understand. And, I've said from day one, and I continue to do it, I have to take the advice offered medical professionals, the chief medical officer, and I understand it's different. And we just, I'm concerned, as I said before, we have on a long weekend in the summer, there'll be 500,000 cottagers going up to the Muskokas, the Halliburtons, up to the cottage area, and they're coming from the 905 and the 416 area, and we just have to be cautious. But I don't disagree with you. That's the thing, but I have to follow science and the medical advice. I always have. I always will. I'll take their advice. And if Dr. Williams doesn't think it's the right thing to do, then I'm following his advice. I have from the beginning. I'll continue to follow it. and the health table, but I fully understand, and I hear it at cabinet, I hear it at caucus, I hear it all the time from our own members. And but I know the Minister of Health is doing a great job, and so is Dr. Williams, and I'm sure they'll come up with a solution to keep everyone happy in the family per se.
Thank you.
Thank you, everyone. Oh, my last thing, happy birthday to the Mayor. It's Mayor John Tory's his birthday, and I want to wish you a happy birthday, Mayor. All the best.